You just returned from Zambia. Can you give us a sense of the current state of the cholera outbreak in the region?
Thank you for having me. The current outbreak in the region is concerning. We are seeing a surge in cholera over the last 3 years. And this is currently underway for the third consecutive year. We are seeing prolonged outbreaks in the region. Since January of 2022, we have seen over 300,000 cases and 5,000 deaths in 17 countries. Many countries are of concern, particularly Zambia and Zimbabwe. And as you mentioned, Zambia is going through a major outbreak, the worst that they have seen in the recent past. But a lot of effort to try and get this outbreak under control as quickly as possible.
So, Dr. Braka, what is fueling this current outbreak, and to what extent is climate change impacting this situation?
The outbreaks of cholera are due to inadequate water and sanitation, and these are exacerbated during rainy seasons. We are seeing episodes of flooding as well as cyclones. As you may recall, last year there were major cyclones in southern Africa, and these have coupled with the water and sanitation situation have led to an increase in the number of outbreaks. Also, conditions around drought. We had the worst drought in 40 years in the Horn of Africa in 2022-2023. These situations predisposed to limitations in access to clean water. That also increases the likelihood of diseases like cholera. We are also seeing in conflict-affected areas displacements of populations and limited access to clean water. That also predisposes to outbreaks such as cholera.
Are there cases where scenarios where climate change, cholera rather, can be predicted? Can cholera outbreaks be predicted and perhaps prevented?
Yes, there are tools for predicting cholera outbreaks. These are available. WHO is working with countries, ensuring that we provide this information on predictions of cholera outbreaks. There is a global elimination plan by 2030, and the African countries have also signed up to that. But unfortunately, progress is very slow. Most countries are not on track. We are going to need a very aggressive, multi-sectoral, comprehensive approach that not only addresses the health component, but water and sanitation facilities to reach that target.
So what can you predict in terms of how these countries, particularly Zimbabwe and Zambia, will see perhaps a positive outcome? How long will it take?
We have seen both countries rallying up aggressive support and interventions to try and stop these outbreaks. And over the last few weeks, we have seen the numbers start to stabilize and in some instances go down in terms of cases and in terms of mortality. So we want to encourage that the effort continues aggressively and that we are following a multi-sectoral comprehensive approach, because cholera is not only a health issue, but it's also a development issue.